Perfect. I'll now give you the detailed 15 differences between menorrhagia and metrorrhagia, organized under headings and explanations for better understanding. 1. Definition. Menorrhagia refers to abnormally heavy or prolonged menstrual bleeding occurring at regular menstrual intervals. It means the period itself is excessively heavy. Metrorrhagia refers to irregular uterine bleeding that happens between normal menstrual cycles. It is often called intermenstrual bleeding. 2. Timing of bleeding. Menorrhagia. Bleeding occurs only during menstruation, but the flow is excessive and prolonged. Metrorrhagia. Bleeding occurs at unexpected times outside of the regular menstrual period, sometimes in between cycles. 3. Relation to menstrual cycle. Menorrhagia. Directly related to the menstrual cycle because it represents abnormal menstruation itself. Metrorrhagia, not related to the menstrual cycle. It can occur at any time irrespective of ovulation or menstruation. 4. Cycle regularity. Menorrhagia. Menstrual cycles remain regular in terms of timing, e.g. every 28 days, but the flow is heavier and longer. Metrorrhagia. Cycles are irregular. Bleeding may appear multiple times in a cycle or unpredictably. 5. Duration of bleeding. Menorrhagia. The menstrual bleeding continues for more than 7 days. Metrorrhagia. Duration is highly variable, may be short episodes of spotting or prolonged irregular bleeding. 6. Amount of blood loss. Menorrhagia. Menorrhagia. Blood loss is excessive, typically more than 80 ml per cycle, often requiring frequent pad tampon changes. Metrorrhagia. Blood loss may be small, spotting, or moderate, but it is not necessarily heavy. Main problem is irregularity. 7. Nature of flow. Menorrhagia. Flow is heavy, often with passage of large clots, leading to flooding episodes. Metrorrhagia. Flow may be light spotting, intermittent bleeding, or sometimes moderate, but not usually associated with clots. 8. Common age group. Menorrhagia. Common in adolescents due to anovulatory cycles, and perimenopausal women due to hormonal imbalance, fibroids, adenomyosis. Metrorrhagia can occur in any age group, but more concerning in older women where it may suggest endometrial or cervical pathology. 9. Common causes. Menorrhagia, uterine fibroids, adenomyosis, endometrial hyperplasia, hormonal imbalances, e.g. unopposed estrogen, coagulation disorders, metrorrhagia, endometrial polyps, cervical erosions, cervicitis, carcinoma of cervix, endometrial carcinoma, hormonal disturbance, e.g. in ovulatory cycles, use of oral contraceptives or IUD. 10. Associated symptoms. Menorrhagia, often accompanied by fatigue, pallor, weakness, dizziness, and symptoms of iron deficiency anemia. Metrorrhagia may be associated with pelvic pain, irregular spotting, vaginal discharge, or anxiety due to unpredictable bleeding. 11. Pattern of occurrence. Menorrhagia, predictable, occurs with every menstrual cycle, but with abnormally heavy flow. Metrorrhagia, unpredictable, bleeding can occur at any time between cycles. 12. Diagnosis approach. Menorrhagia, diagnosed by history of heavy bleeding, 7 days, 80 milliliters, use of pictorial blood assessment chart, blood tests for anemia, ultrasound for fibroids, adenomyosis. Metrorrhagia, diagnosed by pelvic examination, pap smear, ultrasound, hysteroscopy, and biopsy to rule out malignancy or polyps. 13. Risk of complications. Menorrhagia leads mainly to chronic iron deficiency anemia and reduced quality of life. Metrorrhagia may indicate precancerous or cancerous conditions of endometrium or cervix if persistent. 14. Management. Menorrhagia, medical, NSAIDs, antifibrinolytics, tranexamic acid, hormonal therapy, OCPs, progestins, levonorgestrel IUD. Surgical, myomectomy, endometrial ablation, hysterectomy in severe cases. Metrorrhagia, treat underlying cause, e.g. remove polyps, treat infection, correct hormonal imbalance. Cervical lesions may require cauterization or surgical removal. Malignant causes require oncology management. 15. Prognosis. Menorrhagia, usually benign, treatable, but can cause chronic anemia and affect daily activities. Metrorrhagia, prognosis depends on cause, can be benign, e.g. polyps, but also may signal serious disease like endometrial or cervical cancer. Summary. Menorrhagia equals heavy, prolonged, but regular menstrual bleeding. Metrorrhagia equals irregular, unpredictable bleeding between periods. Thank you. Have a nice day.